This is the video on cochlear implants. Cochlear implants are neuroprosthetic devices that are implanted into the cochlea for correction of profound hearing loss. The type of hearing loss the implant works best for is the sensorineural hearing loss, but with the auditory nerve intact. To work at its best level, the implant should be done bilaterally, or on both sides. The cochlear implant consists of external parts and internal parts. The external part includes the microphone, a speech processor, and a transmitter. The internal part consists of a receiver and an electrode array. The electrode array fits on a thin wire. This wire is placed into the cochlea through the round window. It curls around, following the curve of the cochlea itself. The tiny electrodes lie in close proximity to the acoustic nerve fibers at the basilar membrane. This microarray fiber is connected to the internal receiver, which is positioned typically close to the skull behind the ear. The external part of the implant can be worn behind the ear, much like a common hearing aid. The external part of the cochlear implant works by picking up vocalizations and sounds from the environment with the microphone. The speech processor then filters out all sounds that are not part of the speech patterns. This is to prioritize speech from all other noises. This processed and digitalized speech is then transmitted through the skin and skull to the internal part of the device by using radio frequency transmission. The receiver on the inside of the skull picks up the signal and will convert it into electric impulses. These impulses are then sent to the microarray in the cochlea. Remember, the cochlea is tonotopically organized. The microarray will obtain the speech impulse signals and send it to the part of the array for that sound. The neurons in the cochlea pick up the sound from the microarray much as it does sound waves. The cochlear implant bypasses the eardrum, and the ossicles, going directly to the neurons for hearing. This does not mean that it works in such a way that the sounds are normal. Most people who get the implants must learn to interpret what they hear into speech. It may take up to 6 months of therapy and training to be able to hear speech normally. Cochlear implants are expensive, require extensive training to learn how to use, should be done bilaterally, and require the person to undergo surgery to have the device put in. Despite all this, there are around 250,000 people with cochlear implants, as it allows someone who has lost their hearing to listen to people talk again. That is worth the risk and the price. This ends the video on cochlear implants.